Namaskar and a very warm welcome to this edition of COVID Live. Let's talk health neuro queries. I'm Nidhi Kumar and you're watching India Science. Well, India's cumulative COVID 19 vaccination coverage today exceeds 181 crore plus. India reported 1549 new COVID cases, more than 29 lakh vaccine doses administered in the last 24 hours. The recovery rate currently stands at 98.74%. As COVID 19 continues to surge across the world, COVID related queries are on the go. People are speculating about so many things. Today, we talk about neuro. In this program, we take your questions from Facebook and YouTube Live. And today, we are joined by the very well known Padma Shri, Dr. Padma Shrivastava, Chief Neuroscience Center at the All India Institute of Medical Sciences. Many thanks for joining us, Dr. Padma. Welcome to India Science.
Thank you.
To begin with, I'd like to ask you something about the new variant Omicron, how it is panning out across the globe, and what is it like? Is it different, the BA2 syndrome?
So, what is known thus far is that this BA.2 variant is more transmissible, therefore more infectious. Whether it turns out to be much more virulent in its response has not been borne out yet. And just as it's been in the third wave and with the other variant called the Omicron, which was not more virulent, but certainly more transmissible and more infectious and with some immune, kind of evasiveness that it had. So far, our collective COVID appropriate behavior, vaccinations, has proven to be a good armamentarium, a good armor against a virulent disease, and that's what probably will need to be employed even in future for future variants, which may be more transmissible, maybe more infectious, not necessarily more virulent. I hope so. But we need to maintain our caution up and continue with our life as such. So we need to get everything back on track, whether it is our economic, the economics back on track, education back on track, livelihoods back on track. And for that, since we are now better equipped with our knowledge about this disease in the last couple of years, use the experience, keep the caution, radar up, get vaccinated, and get on with lives.
Absolutely. What are the effects now of COVID on brain, if you can throw light on this, and what patients are more prone towards this?
Yes, so it's a very pertinent question, Nidhi, because now we have evidence to say that COVID does involve brain. There's a tremendous amount of literature which has already been published, so I'm not talking, out of air. This is published literature that COVID does affect the brain in ways more than one. So let me start off talking about who would be more predisposed to this. So people who have been more severely affected by COVID and who have comorbidities. So obviously the age was a factor, the more elderly, and who have diabetes and hypertension and cardiovascular disease or cancer or immunocompromised, whoever were more predisposed to have more severe disease. In that cohort, people have observed these neurological features in terms of both during COVID and post-COVID. Post-COVID, we'll come to it a little later, but during COVID, they've observed clots happening in the brain attacks, also infection spreading to the brain, and post-infectious demyelination, and which could be inside the brain, outside the brain, involving the nerves and the cranial nerves, having seizures or epileptic attacks, going into altered sensorium, so on and so forth. All of them, and the most prominent amongst them were having clots in the brain or the brain attacks. So that's a cohort which was more predisposed. But then remember, even the features with which COVID was diagnosed early, and if you remember the first wave, amongst the respiratory features, you have fever, cough, breathlessness, and so forth, even loss of smell, loss of taste was also there. Remember, Nidhi? So the loss of smell and loss of taste also implicated that the brain was involved. Right? So, but then later on, it was seen that even irrespective of the severity, even a mild COVID can affect brain, and even younger people could have brain affected because of COVID. But what's more pertinent and what's become more interesting is what is called as a long COVID. That is, COVID has happened, COVID has recovered, and people get into this 9 months, 12 months, maybe even longer periods of various symptoms. And in that, you must have heard about very common complaints of headache, dizziness, fatigue, and mental fog. These are the four very, very, very prominent and very common complaints. Headache, Nidhi, I feel that anybody who has head will have a headache in their lifetime, isn't it? But these are not the kind of headaches which are commonly felt. Even people who had migraine, that is, chronic headaches, you go out into the sun, you get headache, you don't eat, you have a headache, you have not slept, you have a headache, there's some stress, you have headache. Not just that. Now these headaches became persistent, became chronic, everyday headaches. And they were new onset headaches. And the other thing was dizziness, vague sensation of spinning, feeling of imbalance. And then you had this sensation of generalized fatigue, inability to do something which was commonly done so easily in the past. And the mental fog or the brain fog was a constellation of features which was a sensation of inability to do those higher mental functions which were done with a large city, which were done, you were taking for granted those multitasking, which has become absolutely impossible now. There were memory problems. You couldn't, recollect easily the recent events. You couldn't learn, and there was a confusion in doing executive functions. So something which I could do very well in the past now has become much more difficult, and there's a kind of a confusion. I have to break down the task. I can't multitask. So that mental fog and brain fog, these were the common complaints that people came out with. Besides a long list of other features, which were cardiac or diabetes or gut or, there were a whole lot of things, and of course, lung. So in the long COVID, in fact, 200 complaints were listed and published from the UK just the end of last year. But what is interesting, Nidhi, is the research now, which is getting into it as to how this COVID may affect brain for months and years to come. For example, this loss of smell, people would believe that maybe it is harbinger of something which is degenerative. And added to this mental confusion, could these people be more predisposed to develop dementia like Alzheimer's disease? Diseases like Parkinson's, degenerative diseases. Now, will these people develop that? Now, that's a research which is still going on. We have no definitive answers. But very recently, there was a publication which came in which said when they actually measured, in terms of what happens to the brain by serial MRI, that is a neuroimaging study, and they found that there was shrinkage in certain parts of the brain. That's a documentation again, which seems that COVID, whether mild or severe, seems to affect the brain. So be cautious, take preventive steps.
Absolutely. Thank you so much for those insights. And now, like you to explain to us and our viewers what is muscular dystrophy and what is motor neuron disease, and do these affect children and adults alike, ma'am?
Yes, Nidhi. In fact, muscular dystrophy by definition is, number one, it is genetically acquired. Okay, so genetic disease, and it is progressive. That means it gradually keeps increasing severity. And there is a topography of muscles which get affected. A classic example is what you must have heard about is Duchenne muscular dystrophy. Okay, DMD we call them. So there are a lot of muscular dystrophies which start off from childhood. Even there are varieties which start at the very time the child is born. And in the first decade of life, the second decade of life, and then certain dystrophies which affect at the later part of age and even in adulthood. But the hallmark is it is genetic. That means it's a hereditary disease which may skip generations, and there are varieties of inheritance patterns. It is progressive, so it just goes on getting worse. And there's a topography there's a particular group of muscles which are involved. Therefore, there is a progressive weakness, and depending upon the inheritance, depending upon what gene is involved, depending upon what protein is comes out of that gene. They're different syndromic nomenclature to these muscular dystrophy. So they're bad diseases. It is now recently that there are some breakthroughs which are coming up, and hopefully we will see the end of the tunnel in some years to come. Now, on the other hand, motor neuron disease, Nidhi, is something which can affect in the young, in which case we call it the spinal muscular atrophy, or SMAs, which have come into limelight now because there are certain forms of treatment which is available to SMAs, especially in very young children. And there the disease could be extremely catastrophic, really cataclysmic consequences when somebody is diagnosed with SMA. Varieties of SMA are known. And later on, the same motor neuron involvement is seen in what is called as a motor neuron disease. So the motor neuron disease, Nidhi, is not a good disease at all. It is again progressive. Essentially, it involves only the motor system. And the classic example of motor neuron disease is what is called as amyotrophic lateral sclerosis, or ALS. So you heard of Stephen Hawking, Nidhi? Nidhi?
Yes, ma'am. Yes, ma'am.
Yeah, so Stephen Hawking had, motor neuron disease. And if you can recollect, he was on a wheelchair and he was completely paralyzed. His motor system was just not there, but his brain was functional. And with the advances in technology and assistive devices, he could still write a book just by thinking. And of course, that is the humongous advances in biomedical engineering and the kind of devices which can make it possible. But then those kind of systems don't percolate down to the poorest of poor in a developing world. So ALS has not, unfortunately, had any breakthroughs. But what we do is, when a person is diagnosed with MND, we look for certain secondary varieties. Is there something which mimics motor neuron disease? We look at that. And, we look at what can be a secondary cause of motor neuron disease. We look at them because, for example, there are certain cancers, there are certain autoimmune disorders which may, produce a feature complex like motor neuron disease, and that could be addressed too. But classic MND, unfortunately, has not had a breakthrough. But I'm again hopeful that in the next few years, you may get a breakthrough. But these are bad diseases, yes.
Absolutely. Next question I'd like to ask you is, what is scoliosis?
So scoliosis is curvature of the spine. Okay. So the spine is straight in the back. If you look at the neck, it is slightly curved, isn't it? It's like a swan.
Yes.
And when you look at the lumbar or the low back, it is the reverse. Like, the pelvis is comes into that. Now, so these are the normal curvatures, but the middle of the spine is straight. When it is not straight, it is curved sideways. It is called scoliosis. It can be curved, outward and inward, and that becomes kyphosis. But the one which is curved laterally, sideways, it's called scoliosis. So that's a spine disease.
Right, ma'am. We have a YouTube question now, and it comes to us from Shivam. He says his grandmother is showing loss of smell, taste and hearing, and also confusion. Is it related with neuro, and what is your advice, ma'am?
Yeah, sure. And I think since we do not have more details about it as to when it started, how it started, progression, is it been there for a few years now? Has it just come in the last couple of weeks? Is it related to COVID? There's so many features. I mean, what are the other comorbid conditions? Is she a diabetic, hypertensive? Is there any other, medication she's on? So definitely he should take her to a physician. And if the physician will run the usual general tests and see the common, abnormalities in terms of electrolytes and other serum thing, is there any infection? And certainly refer her to neurologist for further investigation. He should go to the doctor.
He's written it again to tell us that it began with COVID on March 1st last year, and it's still carrying on. If you could enlighten us.
Yeah, so I think she should be investigated. But again, we did discuss what is a long COVID. So, and we also discussed the fact that the elderly and with comorbid conditions are generally worse affected with this. And then we also see that supposing a very elderly, say 80 plus or 75 plus, the elderly age group who already have a compromised situation. Okay, so whenever there is an acute insult in terms of any infection, or which may be COVID, which may be any other issue, then the baseline will go down further. So if they're compromised and they are able to live their normal activities otherwise, but they will not perform at a scale higher if required, when there is an insult, they go down. So what is compromised becomes, so then they become more forgetful, they will not be able to retain, they may not be able to take care of themselves, they will need help. So that is also likely to be possible, called beclouded state or going down in the dementia scale. She will definitely need evaluation. You should take her to the doctor.
Absolutely, ma'am. Please tell our viewers what is Parkinson's disease, as we have quite a few queries coming in, and how can it be treated or detected? What are the symptoms?
Yes, so very good question, because Parkinson's disease is one of the very common degenerative diseases of the brain. Now, the classic way to recognize it is when you look at a person, the person looks as though he has a stare. He doesn't blink very often. The face looks masked, means it looks emotionless. And every activity is very slow. So earlier he could brush and shave and eat, say maybe in 10 minutes, and now he's taking half an hour or 45 minutes to do the same thing. He looks stiff, or he's having tremors in the hands, some pill rolling moments. Okay, and these tremors are obvious when he's doing nothing, called the rest tremors, not when he's actively doing something, because those tremors are different. So the classic example is this, and they may also start to walk in a stoop posture. The steps become smaller, and then later on they feel to be shuffling, and sometimes they seem to be running as though they're trying to chase their own center of gravity. So a change in the posture, the gait, increased time in doing things, some tremors, and also everything becomes slow and low. So even the volume of speech becomes slow. Okay, and they become as though they're mumbling. You'll have to strain to hear them. So this is a constellation of features which is called Parkinson's. It may start on one side, then it will go on the opposite side. That is classic idiopathic PD. Now, this Parkinson's is a very common thing, and it becomes commoner as one ages. In fact, people have said that after the age of 80 years, you have almost 1 in 10 who may have this Parkinsonian features developing. So you may have this develop because of a problem in the brain like a stroke or other issues, or it may happen out of anything else which is called idiopathic Parkinson's disease. And yes, Nidhi, it can be controlled. So the good thing about PD is, if you can pick up early, you can definitely try and control these complaints. The main complaints are motor. There could be a whole lot of other issues with it. They develop constipation, they may have a mood problem, they may have a sleep problem, etc., etc. But the main motor complaints could be controlled, but there are a lot of medications available. And even as the stages get higher and they become more severe, there are interventions now like pacemaker of the heart. You can pace the brain in forms of what is called as a deep brain stimulation. There are some surgical techniques available. So there's a lot happening in the management field. The trick is, if there are issues, if you suspect, please bring them down for a check. They can be diagnosed very well. There are very objective tests available, and there are definitive management schedules available.
Well,
and they're available in India.
Yes, ma'am. My next question is, could you also explain the same way Alzheimer's disease, because we need to know.
Yeah. Right. So Alzheimer's, again, Alzheimer's dementia as such is the commonest, the variety or a cause of dementia. Okay. So now dementia, when you talk of dementia, is that there is a loss of memory. Although memory is not the only domain in cognition. Nidhi, there are 6 domains. Memory is one. There are other domains like a language, your executive functions, even your what is called as your social behavior, your the emotional equanimity. There's so many other domains. Okay, memory is one important domain. So in a dementia, there could be more than two domains which are involved, and they are progressive and they impact the activities of daily living. So in the varieties of dementia, you have treatable ones. Say, for example, the classic example of a treatable dementia, Nidhi, is vitamin B12 deficiency, nutritional deficiencies. Okay, some hormonal disturbance like a thyroid, like hypothyroidism. So these are situations where it can impact your memory. And in the treatable varieties, there are big lists. There could be infections, there could be autoimmune stuff, there could be neoplasm, there could be so on and so forth. But in the other variety, which are degenerative, that is where we come. That list, the heading is Alzheimer's. You can have several others, your frontotemporal, DLPD, several other things, but Alzheimer's dementia is a commonest thing. Now, let me tell you one thing. Vascular dementia is when you have brain attacks. That means there's a lack of blood supply to the brain. Okay? So, as the age advances, you have this mixed varieties. You can have Alzheimer's along with blood supply to the brain, which is vascular. We call them mixed dementias. So, Alzheimer's dementia basically is a situation where you'll find that the person is forgetting, but the person does not complain he's forgetting. A lot of us, Nidhi, are you there?
Yes, ma'am.
So, a lot of us feel that we are not as sharp as before, okay? In the school, children also come and say, मैंने तो सब कुछ पढ़ लिया है, exam के hall में सब भूल गया. That's not dementia, right? And most of us also, we make to-do lists, don't we? Nidhi,
Yes.
I'm sure you also make a
Yes,
to-do
yes,
list.
yes,
Because
yes.
in the morning, when you have so many things to do, at the end of the day, we may forget few things. Oh, I didn't pay this bill. I didn't reply to this email. I haven't done this. So, you check off the multitude of things we do. That's just multitasking. And when you don't sleep well, there's a sleep deprivation. There's so many other things which can cloud, our capacity to perform optimally. That's not dementia. So in Alzheimer's dementia, they forget day-to-day things. Initially it's a recent and recall. It's not remote. They will always remember till the very late, their own name, their children's name, when did the child get married, all that they will remember. But it is a recent events, recall events. They'll forget when they have eaten. They don't know what, to take the medicines. They'll forget ways about the recent recall. All those things will go initially. And language, choice of words, what word to be used, and then they become dependent. And then there's a whole list of things which come with Alzheimer's dementia. But good thing about it again is it can be diagnosed clinically, and there is objective way of diagnosing by doing some tests. There are a lot of good tests now which have come up. Sometimes we can preempt it also, because some of them are also hereditary, familial is possible, and we rule out the treatable ones, and we do institute management. With this management, at least the rate of progression could be retarded. So something without treatment may progress to 5 years down the lane and somebody is bedridden. Now that can be prolonged to maybe 15 years, so that useful life of being independent can be there. So there is hope, yes.
Absolutely. Next question that is coming to us is if you could explain multiple sclerosis and peripheral nerve disorder. Does it have something to do with the brain?
So, multiple sclerosis, Nidhi, is a disease which is very close to my heart. In fact, AIIMS, we started the first public sector dedicated MS clinic. The reason we've done this is it strikes young people. It strikes young people in their productive age when they're just embarking on their choices of life partners, their career growth, their independent, earning ability. They're in that threshold, late teens, early 20s, till early 30s. That's when it strikes. And it is a primary demyelinating disease of the brain, where it could be very subtle. There are multiple events which can happen. So somebody would have suddenly one eye vision is lost. There could be pain, they lose vision, and after a few days it comes back with or without steroids. And you'll feel that, okay, it's just happened, it may not happen again, but it'll happen again. It may happen few months down the lane, or it may happen a couple of years later. And when you do investigate, you'll find a lot of white spots in the brain. And there are definitive criteria, both clinical and as well as imaging and biochemical, to diagnose this now. Lot of advances. And now in our basket of medications for multiple sclerosis, we can manage them very well. Again, Nidhi, the trick is catch it early in the diagnosis. And we have a lot of youngsters which we could diagnose. We started, and fortunately in India, a lot of these medicines are available, what we call as disease modifying therapies, which will prevent these attacks from happening. So there is no disability or deficits which, sort of accumulate down. And a lot of them are now affordable. So there is a lot of hope now, and we see our young people just go about doing their normal life. They get into their professions, they marry, they have children, and it is heartening to see that. But that's possible only when, you catch them young, so that they don't progress to a stage where there is a lot of damage already which has accrued. So it's a classic variety of primary demyelinating disease, and we need to distinguish it from other varieties like, neuromyelitis optica, MOG, and several others. Let's not get into that. Remember that when something unusual happens and it even resolves, come for a check, because you don't know, it may happen again, and we don't know the diagnosis as to why it's happened. So we must diagnose these conditions. And the last one you said is peripheral nerves. Well, Nidhi, peripheral nerves is part of the nervous system. Just like you have brain, then you have the spinal cord which goes down the spine, and from there you have this big fat, sort of columns which come out, which are roots, and from roots you have these several branches which are nerves, and then they branch out and they supply each and every nook and corner of the body. So the peripheral nerves could be motor, could be sensory, and they're mixed, and they are the ones which carry all the sensations, whether it's touch or a pain or temperature, what to feel, pressure, vibration, what have you, and also carry back the impulses and the response. So if there is a burn, then I need to take away my, the foot or something from that burning thing. So both both those things, with the sensation that there is something burning and the response that I need to pull away my foot, all these is served by the peripheral nerves. Very important, complex network. And when there are problems in that, we call them as peripheral neuropathy, which are different, varieties.
Yes, ma'am. The next question is from Ananya from Ghaziabad, and on YouTube, and she wants to know that she's 1 month pregnant and her doctor has advised her to go through nerve conduction test and brain MRI to rule out multiple sclerosis. Is it safe to have MRI and nerve conduction study at this time?
Well, I don't think you need nerve conduction studies to diagnose multiple sclerosis, number one. Second, first trimester of pregnancy, even MRI is not advised.
Yes, ma'am.
Take it, that's a take-home message. We don't do it. We don't do it. And the other thing is, multiple sclerosis during pregnancy is rare. Even in people who are known to have multiple sclerosis, the disease sort of goes into remission. There are always outliers. There would be rare cases whose diagnosis of MS is made during a pregnancy and who may get a relapse during pregnancy, but they're rare. Commonly, it doesn't happen. So I think she should come for a check and we can check this thing. But during the first trimester of pregnancy, MRI is best avoided unless it becomes absolutely mandatory and it is going to be life-saving. That's a different thing, and I don't think that is true for MS. Second, you don't need a nerve conduction studies to diagnose multiple sclerosis.
Absolutely, ma'am. If we're running out of time actually, but my last question to you would be, can you tell us something about brain tumor and how people could, come to know if they are, in that susceptible area?
So 3 things, Nidhi. Though brain tumors by itself would be, I think, several hours of, educational awareness thing.
We may
But
need
how about
another
just take it
session.
this
Yes,
way?
absolutely. Yes.
Yeah, so very broadly, what I would say is if there is a recent onset headaches, not that you've been having headache whole life, not that. Recent onset headaches, change character of headaches, especially when headaches come with, then they're constantly nausea, vomiting, and there is, or there is decrease in the vision. There are visual obscurations which may suggest that there is a raised intracranial pressure. Please go for a check. Second, whenever there is a progressive neurological problem, there is some numbness on one side and it is increasing. There is some subtle change in the balance, it is increasing. Some subtle weakness which is increasing. Or third are seizures. When there is an epileptic attacks, broadly these are the key. There are several ways that the brain tumors can present. Brain tumors can be very cancerous, like when we talk of, grade 3, grade 4 gliomas like glioblastoma multiforme, or benign tumors which may be there for several decades, and even you won't even recognize. One may have it and die with it at the age of 80 years and not know about it, like certain varieties of meningiomas. So brain tumors are a big spectrum, and depending upon where they are in the brain, they may present with that kind of a functional problem. So not every brain tumor you need to chase, but you should be very cautious. And if there is any recent onset of any of these complaints I narrated to you, you must go for a check and the doctor will do the rest. And they're definitely treatable now with advances in surgery, with gamma knife, with radiation, with chemotherapy. Again, trick is to catch them young.
Absolutely. And on that note, I'd like to thank you, Dr. Padma Shrivastava, for joining us today and
Thank
sparing
you.
your valuable time and educating us. And with this is a wrap on Let's Talk Health. We'll be back with more interesting editions of Let's Talk Health next week. Until then, stay safe, keep that mask up, and stay protected. Don't lower your guard. On that note, keep watching India Science. Many thanks for watching. Namaskar.